One of the things I get asked a lot is, can I recover from my pain? Will my pain get better? Will this work for my pain? Okay, so that's what I'm going to answer today. So my name is Lindsey Ford. I'm a pain coach and an occupational therapist, and I specialise in helping people to recover from chronic pain conditions, from persistent pain. So let's answer those questions now. So can I recover? Can I get better? So the first thing I would always say to anybody who's experiencing chronic persistent pain, that's pain that's been going on for more than 3 months, is you need to get this checked by your doctor. You need to have the test done to rule out anything serious. Because if it's an infection, if it's an acute injury, so a short-term injury, then it's going to hurt, yeah? If it's an infection, it's going to hurt. You might be able to hear my dogs in the background there. They're plodding around. If it's a serious illness such as cancer, it's going to hurt, okay? And these are all things that you need to get checked out and verified for, because these need different treatment. These need looking at differently and dealing with differently, okay? So that's your first port of call always. Once you've had all that ruled out, yeah, and there's nothing else going on, or they may come back with scan results and say, oh yeah, look, this is going on in your joints, in your bones, in your spine, okay? But if it's not an infection, it's not cancer, and it's not a short-term injury like a fracture, then you're good to go, okay? So then it'd be really useful to look at, for me to tell you a little bit about John Sarno. So John Sarno was an American doctor who specialised in back pain. And what he found time and time again was that he realised that his patients he was seeing that had back pain also had a lot of other conditions that are known to be connected to emotional issues, that are known to kind of have that emotional connection, like eczema or headaches, things like this. And he just thought, I wonder, are the connections with back pain and emotional issues too? And he started talking to his patients and educating them about actually the pain in your back is due to tension. It's not due to an injury. It's not due to any sort of structural damage. It's emotional. And that's what's causing it. It's about tension. It's about a stress response in your body that's causing it. And what he found is he got amazing results and people recovered. And he actually got a better recovery rate using this approach than the surgeons did, or the traditional approaches did, that use medications and use injections and things like that. Yeah, so this is obviously saying I'm onto something here. Yeah, he was definitely onto something. So Sarno, if you've not heard of him before, I'd hope you all have, but if you haven't, look him up. He died a few years ago, and well, I say unfortunately, what I feel is sad is that in the whole time that he was practicing, he was kind of ostracized from the medical world because he didn't follow the standard procedures, because he was thinking outside the box. Yeah, so unfortunately, even though he got amazing results, his fellow colleagues shunned him, which seems a real shame. However, I guess at the end of his life, it was becoming more and more accepted that this was an acceptable approach, and that this was the way forward, in my opinion. Okay, so that's kind of a bit of background. So he coined the term TMS, tension myositis syndrome, which was just about saying there's tension in your muscles, there's tension in your fibers, and that's what's causing this pain. Okay, so it's just a descriptive term really, but TMS you'll hear flung around, and I'll mention it, and it's about saying it's mind-body. It's about your mind and your body interacting and having this communication, and your mind saying you're not safe and giving you the symptoms in your body. And that's literally what it's about. It's about tension. It's about not feeling safe. Yeah. So can you get better? Yes, you can. So people with back pain, even though you'll have had scans done, probably tests done, because if it doesn't get better, then they're going to look into it further. Okay. My dog's now chewing sticks. And quite often scans will show that you've got some sort of spinal degeneration, you've got wear and tear, you may have some disc bulges, you may have some herniated discs, you might have spinal stenosis, which is like a narrowing of the spinal canal. Yeah, you may have all of these things, they may show up on your scans. What has been found through multiple studies is that everybody, pretty much about 80% of the population, has got these changes, but they don't necessarily have pain. And that even if you've got these changes, if you do the mind-body work, then the pain will still go. So therefore, how can that be the cause of it if even though you still got those changes, the pain will go? Do you know what I mean? So what you tend to find as well is that your symptoms don't necessarily match up with the scan results. So if you've got a trapped nerve in whatever, I don't know, L3, then you would only experience symptoms in a specific place. What people really, really often find is that the pain symptoms or whatever it is they're experiencing, they move around, they come and go. Yeah, if it moves around to different parts of the body, to different sides, to different areas, that cannot be caused by that specific structural issue. If it comes and goes, in that some days it's just not there, that cannot be caused by a specific structural issue, because that structural issue is always there. It doesn't just come and go, it's there. Yeah, so there's no connection there. People often find that the symptoms will be worse in the morning after they've had a night in bed. Again, that doesn't make sense. It's like we tell ourselves these stories to try and make sense of stuff, but actually the stories we tell ourselves, if you look at them deeply, they don't really make sense. Why would your pain be worse after a night of rest, in bed, fully supported? That doesn't make sense that it's about your physical body. What happens at night time is that your brain is unchecked. The conscious mind goes offline and your unconscious mind, your subconscious mind, gets free rein to do whatever it wants. So your subconscious is just running riot overnight, and that's quite often why people have worse symptoms in the morning, because they've had all night of all of this chaos, I guess, going on in their minds, where they're not distracted, and their unconscious can do whatever it wants. Other things, so comes and goes, moves around, worse at night. Yeah, it doesn't match up, so that you might be able to do some activities that you would expect to cause pain, but not others that you would expect to cause pain. Again, it needs to be consistent. If it's not consistent, then it doesn't make sense. And once you start looking for these anomalies, if you can stand up for a period of time to do one task, then you should be able to stand up to do all tasks. Yeah, but quite often people will find that there's specific tasks they can't do. They may struggle when they're standing to wash up, or they may struggle at work, or they may struggle. It's be certain situations. It's kind of looking outside the box, isn't it, as to what are those situations and what does that mean. So usually it's a situation that we're not particularly happy with, we're not very comfortable in, and it's like your brain's way of going, you don't want to be doing this. Yeah, so I'll find a way to make sure you don't have to. And that's kind of how it works. So what I'm saying is, if it's not structural, it's about your brain. So this is any back pain, joint pain. Again, they've found from scans and tests that many people have joint issues, have joint pain. No, wrong way around. Many people have structural damage to their joints but don't experience any pain. Over the age of 20, we've all got worn joints, because that's just how it works. If you use something, it gets worn, but it doesn't have to cause pain. And I know from my previous work sort of as an OT, as an occupational therapist, seeing people who actually, there was a guy who I saw whose hip joint was so worn, he didn't have a ball on the top of his femur anymore. It had gone. But it had absolutely no pain. He was actually fused at 90 degrees between the top of his femur and his pelvis. Yeah, which isn't ideal because he couldn't stand upright. but he didn't have pain. And he didn't have pain in his back either, which you'd expect, wouldn't you, with all that kind of strain of standing at such a strange angle. Stuff like that, you think, that should hurt. That really should hurt. But it didn't, because actually, wear doesn't cause pain. Which is a bit of a, isn't it? So joint issues, trapped nerves, again, quite often you'll find that it comes and goes. So if you've got a trapped nerve, you've got a trapped nerve, yeah? So if that nerve is causing pain, then it should be there all the time, okay? Headaches, migraines, so yeah, these sometimes people are like, well, that's not long lasting because it comes and goes. The condition is long lasting, so that will still be classed as chronic and persistent because it just keeps on going back. So headaches, yeah, definitely, you know, quite often people will make these connections, won't they, with it's about caffeine, it's about intolerances, it's about red wine, it's chocolate, all these sorts of things. Again, there's not particularly any correlation, and what you find is when you do the mind body work, it will go regardless of having chocolate, red wine, coffee, whatever it is that you have made the connection to with your brain. And that is more about conditioning, which we'll go into in a different video. So I guess what I'm trying to say is, yes, you can recover, you know, regardless of what it is. If all those other things have been ruled out, infection, fracture, cancer, then yes, you can recover, absolutely. Because ultimately your brain is the control center for everything that happens in your body. So really the way I tend to look at it is that every health condition, every system in our body is controlled by our brain. So if we can work with your brain, or if you can work with your brain, then you can help it to work at its optimum. You can help it to work the best it possibly can, and help it to have the right healing environment for your body to function 100%. I hope that makes sense. It all makes sense to me. So ultimately, all chronic health conditions are tied in with your emotions, absolutely. So it's about working with the emotions, working with your stress response, working with your brain, because your brain and your emotions and your stress response are all tied in together. So it's doing that work together. Okay, so I hope that helps. I will do more about all of these things in more videos, so check out the other videos and see if there's something helpful there.